I am Dr. Krishnam Raju, a consultant nephrologist at One Life Clinics in Vishakhapatnam. So today I am going to discuss briefly about the importance and advice about diet management in patients with diabetes and also having chronic kidney disease. So diabetes is the most common problem which is leading to chronic kidney disease in the modern era. So the impact of this diabetes on kidney is so huge that the number of patients with diabetes are increasing, and hence the patients who are progressing to chronic kidney disease are also increasing. So according to one estimate, there are 41.5 crore people with diabetes in the world. And in India alone, there are around 7 crore people with diabetes. And you can imagine that around 50% of these people may progress to diabetic kidney disease, and around 50% of those who have progressed to diabetic kidney disease will end up with end stage kidney disease, that is requiring a dialysis or a kidney transplant. So you can imagine the magnitude of this problem. So chronic kidney disease is common in India and worldwide. So chronic kidney disease merely means that the kidney disease has been present for quite a while. In medical terms, any kidney disease which has been present persistently for more than 3 months, it is called chronic kidney disease. It doesn't mean that all patients with chronic kidney disease will need dialysis. There are different levels of kidney damage, and just CKD is a blanket term which will include the minutest of kidney disease to the most severe, that is requiring dialysis or kidney transplant. And there was a research study called SEEK, that stands for Screening and Early Evaluation of Kidney Disease, which estimated that the prevalence of chronic kidney disease in India is around 17%. That is that is 17 people in 100 people in India are having some form of chronic kidney disease. And they also estimated the cause of chronic kidney disease in India. So, and around 31% of people who are having chronic kidney disease are due to diabetes, and this is relatively less compared to the worldwide estimate. In worldwide data, around 45% of patients having chronic kidney disease are due to diabetes. So, as we all know, diabetes, there are certain scopes for reducing the severity and progression of diabetes by dietary modifications. So, dietary adjustments are very important for all patients with diabetes and CKD. They are an important part of the care plan for diabetic CKD patients, and dietary indiscretions may contribute to the rapid progression of chronic kidney disease. And the right kind of dietary interventions will play a significant role in controlling the complications and progression of chronic kidney disease. So, what can dietary indiscretion in chronic kidney disease patients with diabetes cause? So, major issues in patients with kidney disease due to dietary indiscretions are excessive sodium retention, which will cause excessive water retention. So, there will be a lot of swelling of the feet. There may be increase of blood pressure due to this problem. And the more important and which problem which the doctors also fear is the problem of hyperkalemia, which is a high potassium level. So I will discuss more about this in the coming slides. Another issue is hyperphosphatemia. So phosphorus is a kind of mineral which is found in our body, and the kidney normally eliminates most of the phosphorus. And in chronic kidney disease, because the kidneys are not functioning at 100% level, there will be buildup of phosphate levels. And another important thing is the accumulation of the protein degradation products, that is blood urea nitrogen. So all protein which we take, the excessive and toxic metabolites are excreted by the kidney, and this process is affected in case of chronic kidney disease, and hence there's a buildup of blood urea nitrogen. Another problem is the other extreme, where patients who do not take proper nutrition are undernourished or malnourished. So there is a need for optimal diet in individual CKD patients, and it will vary depending on the level of the kidney problem, the severity of the diabetes, and associated comorbidities. So, with careful planning, we can follow a good kidney diet and even control your blood pressure. So, we have to have a balanced approach which will benefit both the kidney disease and ensure adequate diabetes control. So, what are the goals of this dietary therapy in diabetic CKD patients? So, one thing is controlling your blood pressure is the fundamental step in slowing down the progression of kidney disease, because the increased blood sugar will not only affect your kidney, but there are other organs, mainly the heart, the retina of the eye, the peripheral nerves, the brain, and then the kidney. So there are microvascular, that is small blood vessels, and large blood vessels, macrovascular organ damage, which can happen whenever the sugar is high. So controlling or preventing high blood pressure is another critical part of our care, because when there is a chronic kidney disease, that is the point at which the blood pressure takes a hike. So even if they have normal blood pressure, when patients develop chronic kidney disease, because the sodium and there is disparities in fluid excretion, there is a scope for increasing the blood pressure to another notch. And finally, eating a moderate amount of protein is another change which one should make to reduce the workload of our kidneys. So, what are the key nutrients in managing diabetes related kidney disease? So, we'll go to each one of them. So, the most important nutrient is sodium. Sodium is the vital mineral that is present all in and around the cell. So, sodium is like a sponge which attracts water. So, more the sodium in the body, more the water in the body. And whenever there is excess water, that will cause increased blood pressure, because normally when any excess water is regulated by the kidney. So, when the kidney is not in a position to excrete or maintain optimal fluid volume, there will be an increase of blood pressure. And sodium will also help to maintain the pH balance, and it is important for the proper functioning of the muscles and the nervous system. So, as I mentioned, when the kidneys start to fail, the sodium excretion is affected, and they will in turn cause accumulation of fluid in the tissues. So, this is the reason most patients with kidney failure will come with swelling of the feet, facial puffiness, and have breathing difficulties on lying down. And excess sodium also cause blood pressure to rise. Sometimes they may end up with a condition called acute pulmonary edema, where there is excess of fluid in the lungs, and it can sometimes be very dangerous, leading to ICU admission and sometimes death also. And too much sodium in the diet can contribute to the damage of the kidneys and exacerbate these swellings. So, if we are on a low sodium diet to manage diabetes and kidney disease, it is essential to know that where the sodium is coming in your dietary intake. So, all stored foods, processed foods, they have salt. Salt is a very important preservative, and so all preserved foods invariably contain excess amount of salts, and these are the foods to avoid. So any snacks such as chips, any crackers, popcorn, sunflower seeds, and processed food like any kind of bacon or pork or anything which is stored for a long time likely contains salt and should be avoided. Fresh meat, on the other hand, may be taken. And the foods to be avoided are in dairy products, buttermilk and cheese, any canned foods which again contain excessive salt, fast foods and frozen foods, and cheese such as cheese products and pasta with macaroni, spaghetti. All these are likely having very high amount of sodium. Coming to the next important mineral, that is potassium. So the potassium is needed by the body for almost everything it does. It is important for kidney and heart function, muscle contraction, and transmission of messages within the nervous system. So in diabetic kidney disease patients, although potassium is important for kidney function, the normally the kidneys will keep whatever potassium is required and send the excess potassium outside. So when the kidneys are not in a position to send up extra potassium outside, they build up in the blood, and this condition is called hyperkalemia. Also, inherently diabetics have a condition called type 4 renal tubular acidosis, in which there is a buildup of scope for buildup of potassium. So when these two conditions combine, the patient is at a very high risk for potassium. And an excess of potassium can be dangerous because it will cause arrhythmias, which is an abnormal rhythm in the heart, which can become severe enough to cause a cardiac arrest. So such patients may suddenly have a heart attack and die. So that is why it is very, very important to monitor the potassium levels and make adequate modifications in the diet to reduce the potassium. So there are some fruits which contain very high potassium. So common are apricots, banana, avocado, and dry fruits such as dates, and fruit juices and such as orange juice, pomegranate juice, prune juice, and papaya, mango. All these have very high potassium and are to be avoided, especially in patients who have a tendency for high potassium. And certain vegetables such as beetroot, broccoli, carrots, white mushrooms, lady's finger, potato, including sweet potato, pumpkin, spinach, all these will have high potassium and need to be avoided. The other common fast moving consumer goods, you have chocolates, milk, nutritional supplements, nuts and seeds, peanut butter, yogurt. All these also have high potassium. So there is a way of cooking foods to reduce potassium, that is called leaching. So once all the food materials which are intended to be cooked should be washed in water, they should be heated, and then the water should be discarded. So this eliminates some of the potassium and the reduces the potassium intake in the diet. This process is called leaching. Another important mineral is phosphorus. So phosphorus is a mineral mainly stored in the bones, and also small amounts are found in teeth, DNA, and cell membranes. The major function of phosphorus is to convert the food into energy. It also plays a role in muscle contraction, nerve conduction, and healthy kidney function. So phosphorus is also component of bones along with calcium, and is inherently needed to build strong bones. So why it matters in diabetic CKD patients are, so when functioning normally, kidneys filter excess phosphorus out of the blood, but when disease, phosphorus slowly builds up in the body. Some patients on dialysis are able to, the process is able to remove phosphorus, but still it is not as efficient as that of a natural kidney. And all these excess phosphorus will combine with calcium and cause calcification in the blood vessels. That is, your blood vessels may become hard, and that will increase the blood pressure, and also cause the blood circulation to that part of the body to be affected, and that can increase risk of heart attack, stroke, death, or amputation of that particular organ in case of extremities. So foods which are to be limited to restrict the phosphorus are like cocoa and chocolate drinks. Most important is dark colored colas, all the Pepsi, Coca Cola, all these and chocolate milkshakes. All these are high in phosphorus, especially anything which contains chocolate. And canned iced tea, dairy products including milk, milk-based drinks, cheese, custard, pudding. All these are very rich in phosphorus and should be limited in case the patient is having hyperphosphatemia. Coming to carbohydrates. So carbohydrates are the nutrients which are the primary source of energy for the body. So there are simple carbs and complex carbs. So simple carbs are that is they are used nearly immediately upon consumption, or energy is produced immediately after consumption. And complex carbs, which are also called starches, are converted into glycogen, which are stored and used at a later time for energy. And very excess carbohydrates will be converted into fats. So why it matters in diabetic CKD patients are that when a kidney disease has resulted from diabetes, the managing carbohydrate intake will play an important role in treating the kidney disease, because excess levels of sugar, that is glucose, is one of the causes of kidney damage. So we have to lower the intake of carbohydrates that are rich sources of potassium and phosphorus. So the foods to be considered are foods which are very low in carbs, such as water, like green tea, iced tea, herbal tea, anything which does not involve milk and sugar, and beverages which are low in carbs, such as almond milk or soy milk, low fat or non-fat milk, Greek yogurt, and legumes such as beans, peas, pumpkin, non-starchy vegetables, and air popcorn without oil, and whole grain crackers, whole grain cereals, etc. And foods to be avoided are fruit juices, soda, anything which needs artificial sugar in them, such as juices with sugar, lemonade, vitamin water, flavored milk, etc. And white bread, multigrain bread, white pasta, rice, all are very high in carbohydrates. So they should be limited. And crackers, chips, sweetened dried fruit, cookies, cake, ice cream, candy bars, cereal bars, all of them are very high sources of carbohydrate. Some people tend to use honey or some maple syrup sometimes to like as a substitute for sugar, but even those also will increase the diabetes and increase the sugar levels. So coming to proteins, the human body relies on protein for just about everything, and skin, hair, muscles, organs, and hemoglobin all are made up of proteins. And enzymes that break down the food and spark chemical reactions are required proteins. And many hormones, including insulin and other metabolism regulating hormones, are also proteins. So why it is important in diabetic kidney disease patients are that because the all the excess protein needs to be filtered by the kidney. So whenever there is the compromised function of the kidney, excessive protein will increase the workload on the kidneys, and that will cause early damage of the kidneys. That is the main rationale by which in early stage of CKD, it is advised to restrict protein. So, besides further damage to already compromised kidneys, buildup of protein waste such as blood urea nitrogen will cause symptoms such as nausea, loss of appetite, weakness, and changes in taste function. So for reducing the protein intake, so we have to take fish, poultry, low fat or fat free dairy foods. So some cultures, they have a very unique way of cooking non-vegetarian food with extra spices, oil, masala. So that kind of cooking needs to be avoided. So so in that way, if we can cook in a more healthy way with limiting oil to as much low as possible, then fish and poultry can be taken. But in most of the cultures, at least in India, that's not the way people cook. So it is better to avoid non-vegetarian food till there is a adequate balance of protein. And other foods to include are beans, lentils, nuts, peanut butter, seeds, and whole grains. So coming to fat. So fat is also very important and plays a vital role in overall health, especially in patients on dialysis. They have low fat due to malnutrition. So that can interfere with the immunity and makes the person susceptible to infection. So fats are the ones which provide energy, and it's a building block of membranes throughout the body. And it carries essential fat soluble vitamins such as A, D, E, and K. They also help to regulate blood pressure and other heart functions. So why does it matter in a diabetic CKD patient? Because certain types of fat are unhealthy and they can raise the blood cholesterol, which is a factor for atherosclerosis, and that can clog the blood vessels and increase the risk of heart attack or stroke in patients with CKD who are already more susceptible to these problems. So hence, healthy fats should be included, which are like avocado, unless you are having high potassium, and nuts like almonds, cashews, peanuts, peanut butter, peanut oil, corn oil, soybean oil, sunflower oil, tofu, walnuts, flaxseed, and flaxseed oil. So these are some healthy fats which should be considered in patients who are having malnourished kind of habitus or in advanced stage of CKD. And unhealthy foods to be avoided are high fat meats, high fat dairy products such as ice cream, whole milk, butter, cream sauces, chocolate, palm oil, palm kernel oil, coconut oil, especially chicken and anything involves the skin such as KFC and other kind of junk food, processed foods including crackers and chips, egg yolks, liver, and other organ meats. So, finally, the key to success for controlling diabetes related kidney disease is to eat 3 meals a day, no more than 6 hours apart. Try to eat at regular times so that you don't have a risk of hypoglycemia. And if you can't eat a meal, make sure you are having some kind of snack handy in case you feel hungry. And avoid simple sugars such as soda, soft drinks, candies, jam, and honey. And you can use these sugar substitute that sugar free substitutes for tea and coffee. And most important thing is, try to do some physical activity each day. You can do jogging or brisk walking for half an hour a day for at least 5 days a week. And the more you do, your body will have a metabolic memory. In some research, it has been shown that your body will remember your exercise and convey the beneficial effects for as long as 10 years. And use your glucose meter as directed by your doctor, and not when and where you feel like checking. It should be done in a methodical way, such as during fasting and exactly 2 hours after the meal. And sometimes your doctor may advise you to check pre-meal sugar such as 1 hour before lunch or dinner. So discuss with your doctor and then check your blood sugar and make a note of it, because if there is no documentation, it is difficult for the doctor to suggest alterations in your diabetes medication. So make a good note of it and maintain your blood sugar in the range recommended. So with your cooperation, that is the patient's cooperation and involvement only, we can get better outcomes for all patients with diabetes and chronic kidney disease. Thank you.